TC Jewfolk is supported by Maslin LLP, a Minneapolis commercial law firm dedicated to providing solutions for businesses, supporting the community, and advancing civil rights for more than 65 years. With particular appreciation of partner Leora Maccabee's contributions as a founder of TC Jewfolk, Maslin is proud to uphold the legacy of our founders Samuel H. Maslin, Marvin Borman, Hy Edelman, and Irving Brand. We are committed to serving both the community and the profession, as well as providing an exceptional standard in the practice of law. From corporate counsel to bet the company litigation, Maslin LLP. Online at maslon.com. Shana Tova to all. Welcome to this week's Who the Folk podcast. I'm Lonnie Goldsmith, the editor of TC Jewfolk. This week I talked to Dan Stein, the Dakota County public health consultant and Mason County, Washington public health officer. We talk about the role of his positions during the pandemic, why he took his medical practice in this direction, and how he did on Survivor Minnesota on this week's Who the Folk podcast. Dan Stein, welcome to the Who the Folk podcast. Thank you for joining us this week.
It's my pleasure. Thanks for having me.
So there's two main things I want to talk to you about. We're going to start with the decidedly less fun before we get into because I don't think you could do it the other way around. It would sort of be a weird transition. You're a physician, and you're a primary care physician. You have a public health practice, and being as we're 17 months, still at this point in a pandemic. What has that experience been like for you? And is this sort of what all of your training has come to this moment?
Well, so it's been very eye-opening, this whole experience. So I'm trained as a family physician, and I've been working as a family physician over in Washington State for the past 8 years. And recently I started to transition some of my practice over to a public health practice as well. So I started taking over for working at a county health, public health office as their health officer over in Washington State.
Okay.
And I'm actually continuing that position currently. But as you were mentioning, it's been eye-opening. This is my first foray into public health, and my position at Mason County in Washington started pretty soon before the pandemic started. So I'd been working there for about 6 months before having to deal with a large-scale pandemic. So this does bring into all of my public health training and my primary care training as well. It's been interesting to look at both kind of the micro version and the macro version of caring for a large scale communicable disease. So I get to be working with individual patients on their health journey and treating them for COVID as well. But also try and think not just individually, but on a community scale, so that I can think of what's the best action for reducing the spread of this large scale disease.
So, okay, there's a lot I feel like to unpack in that. I guess at the basic level, though, I think most people know what a family practice doctor is. What does a public health practice looks like? Obviously there's the county work, but how about how that works in more as a practitioner?
So it's widely variable. There are lots of different ways that different people, not just physicians, get involved with public health. It can vary from public information specialists, so they can ways to distribute public health information, to epidemiology, to whatnot. My specific role with the county out in Washington, as well as I'm the medical consultant for Dakota County as well, deals more with kind of large scale kind of broad-based community health. So, for instance, I'm charged with being the authority for the county in terms of environmental medicine, or environmental health, I should say, emergency preparedness, communicable disease management. It goes all the way down to water and sewage safety, food safety, and all that. So it's um, in Washington State, and I don't want to get too technical, but Washington State, the authority for the health department lies with the role called the public health officer,
Okay.
which is my role. And so basically anything that is that legally goes through the health department comes under my name.
Okay.
So I review all health and death, birth and death records that come through the county. I review building permits and septic system regulation. I work with our syringe exchange and work with communicable disease management through that site. I ensure that our jails are safe and there aren't large outbreaks going on in the jails. So it's pretty broad and varied.
Yeah, there's a lot of touch points there. There's a lot of different areas that the work you do matters, which I think goes to underscore how much public health matters to every department in a governmental level.
Absolutely. And it's also harkens down to having a fantastic staff at both Mason County in Washington and Dakota County in Minnesota, that I have a lot of trust in them, that they are able to give me the information that I need to make good decisions. And that, because I'm very part-time at both of those roles, that they're able to hold down the fort when I'm not available. Because my main practice is both with health partners as a family physician, and also I direct the clinic in Apple Valley.
Okay. Got it. So Washington, I would think that would be a really interesting experience, not just obviously for the experience, but the timing of coronavirus. Washington was one of, if not the first place in the United States where you started seeing positive tests. Is that right?
Yeah, it was the first.
It was the first. Okay.
The first cases that were diagnosed. We now know, after genetic evaluation of coronavirus, that it was likely circulating in other states prior to being diagnosed in Washington. But yeah, it was very early on that we had our first case. I'm trying to remember I can't remember the exact date, but yeah, it was. I remember the first time I heard about coronavirus, and it didn't have COVID-19 name yet, but it's become a large part of all of our lives. But I'd say that it's definitely changed my life significantly.
As the outbreak was happening, did you start to regret a little bit your choice to transition to the public health out of the more family practice side of medical care?
I would say no.
Okay.
There have definitely been frustrating times. It's been, but it's also a huge honor to be able to work in this field, especially have the ability to impact the health of a population at this kind of integral part of this integral period. So I mean, I've learned a heck of a lot about not just the health aspects of public health, but also how to be a face for a health department and for public health, how to distinguish, how to extend information to the public, how to write letters, and also just make those big decisions. Of course, the unfortunate aspect that has come up is obviously political aspect. Political parties have become involved with this, and my role in public health is not technically a political role, but it definitely has big political implications in that I work with elected officials in making the health decisions for a jurisdiction. And so um, I think I've learned how to interact with our elected officials in order to um, work with them instead of against them, including our Board of Health. Unfortunately, several of my colleagues and even my mentors have even been let go of their positions for largely political reasons. And but I've thankfully had the support of my staff and my Board of Health and my commissioners. So they've been able to allow me the ability uh, to make some of these hard decisions and give me support in those decisions.
So, how do you take the politics out of the public health sphere? Because obviously, science, yeah, I say this and it feels like a basic thing to say, but obviously, plenty of people would disagree with me. Science isn't or shouldn't be political. Science is science. So, how do you want to see the politicization of the science stop?
It's an excellent question. I don't know if I have a clear answer to that.
And if you did, there would be much bigger things lying ahead for you, because that's obviously that's the golden egg right there.
Absolutely. And it's also been interesting because I work in Dakota County and in Mason County, and they're very different counties in terms of political makeup. Mason County is a very small, generally conservative county, and Dakota County is a big mix of urban, suburban, and even rural types of populations. I think the big picture is meeting people where they're at to give them the information that makes sense to them, and to hopefully trust that people, if you give people good and quality scientific data, that they'll kind of you'll gain their trust. Um, it's been interesting working in this because I try to be scientifically minded, as hopefully all providers are, but uh, the science is evolving, and we're learning as we go. So something that we um, when we learn as we're going, trying to convey a consistent message is challenging, and when we say two different messages, one month from month to month, people lose their trust in the science. And so that's the challenging aspect of just giving full giving guidance and information to the public in an evolving situation. And I think that just being forefront with that with that reality that, yeah, we didn't know everything when this first came out, and now we're learning. And some of the messages that we're saying, including masking and masking, distancing, and those kind of things, are really the forefront of how we're preventing spread. We now have more tools in the vaccinations, which are still found to be very effective. But some other aspects we've learned are not as big of an issue, like surfaces. We've learned that COVID doesn't spread very frequently on surfaces. So, making sure that everyone is, common practices are still needed, including hand washing and all that kind of stuff for other disease prevention. But for COVID, it's not as big of the issue. But masks, distancing, vaccinations are still kind of the consistent message that we're trying to convey.
So when you talk about messaging, and I think one of the things that we've seen, certainly at higher levels of government, once you get to the federal level and the doctors working at that level in those briefings, is trying to counter the disinformation. Have you come across a lot of that, whether it's face to face in meetings, social media? You've had to debunk. Is that something that's a regular thing? The smile there tells me it probably is.
Absolutely. And people are scared and people want to find answers. And, I don't blame people for seeking out that information. I think that as a public health official and as a family physician, I have to really try to hone in on what's good and what's bad information. So trying to steer people towards reputable sources and things like that. And to come at to respond to people who are asking me that as they're assuming best intent. I think that that's really the big name of any kind of interaction that I go into, is that you want to address everyone who you talk to, assuming that they want the best for themselves, they want the best for their community, and they're confused or they have real questions. And so distributing information that is trusted and true to the best of our knowledge is important. I even have a professional Facebook page that I try to put advice and scientific data on from trusted sources, in order to make sure that people recognize that these things are real and you can trust them. But we always we're always looking at new issues. Like just recently, we're getting a huge number of increased people calling poison control about ivermectin overdoses, in terms of preventing I should say treating COVID-19, which doesn't have adequate scientific data to support, and is potentially leading to certain harms.
And ivermectin, if people don't know, is typically used as a horse dewormer.
It's an antiparasitic drug.
Yeah. Don't use that. That's not good. It's not good for you. Yeah, that's got to be, it's just dangerous that this is the stuff that you have to try to encounter. And it would seem common sense to, not use an antiparasitic veterinary medication on yourself. But
yeah, I mean, I again, these are people who want to protect themselves and want to protect those around them. So I don't blame them for seeking out those answers. We really do want to focus on what we know. Drugs have different uses, and sometimes we do find that drugs can help treat things that are not necessarily what they're originally designed to treat. But we want to really focus on that. Yeah, not at this point. We know that after millions and millions of doses of vaccines, that they are shown to be very effective in preventing COVID, and they're very safe. There's nothing in medicine that we do that does not have risks, and those risks can be scary. I'm sure that people have been hearing the stories about certain complications of people who get the vaccine, and it's not 100% effective. People can still get sick, and unfortunately, rare people can still die from COVID, even though you've gotten the vaccine. But we know that the risks, or I should say the benefits have been shown time and time again to be far exceeding the risks, particularly with these vaccines, and also particularly with this new Delta variant that's coming out. And This Delta variant is the real deal. This is one of the most communicable respiratory infections that we've seen, unfortunately, and we are seeing that it is infecting uh, younger, healthier individuals, and we are seeing that this new spike is starting to or has caused our hospitals to fill up again, and the death rate is increasing. Again, looking at the statistics, and that's what I do, is look at statistics. The vast majority of people who are being hospitalized and people who are dying are the people who have not gotten vaccinated.
Okay, can we switch gears to happier, more fun topics?
Absolutely.
Because that would be a real downer to end on. The other reason I wanted to talk to you, and I will freely admit, I did not know this was a thing until I was told about it. You were a contestant in the Minnesota Survivor competition, or is it Survivor Minnesota?
Minnesota Survivor.
It was Minnesota Survivor.
Yeah. So, I mean, this is...
And you did very well.
Well, this is the first time that we've done this. Actually, it's not kind of a broad, widely applied for thing. It's actually just a thing that my friends organized and performed. But it was a fun 4-day event that they designed, basically similar events as the TV show Survivor, in one of the state parks in northern Minnesota. And we were given just rice and lentils at the beginning, and had to do the whole social play and competitions to get rewards and everything. And it was a lot of fun. I ended up losing on the final vote in front of the jury, if anyone's ever watched the show. But yeah, it was a great time, and I hope it just grows from here.
So were you a fan of the show?
As many people, looking for that pandemic activity, I did stream several of the seasons before attending, and it's a very streamable, or like it's
bingeable.
A show that's easy to just kind of have on in the background, and just kind of watch as you're doing other activities. But I wasn't a huge fan before I knew that I was going to be on it, and so then I'm a competitive person, and I want to make sure that I understood the strategy and kind of how to play the game. And yeah, it was very fun.
So are you an outdoorsman or outdoorsy at least?
Yeah, I mean, that's where I find the most peace. I love the outdoors. I actually just got back from the Boundary Waters this past about 5 days ago.
Okay.
And yeah, I try and be in the woods as much as possible. It's just peaceful and quiet, and trying to get away from technology is so incredibly important.
So
I would say that this Survivor experience was not getting away from technology. You had people following you around with cameras and doing interviews and all that kind of stuff.
So they really treated this like the real deal.
They did, yeah, and they are even kind of gonna compile all the videos and try to make an actual season of Survivor out of it. So
that's incredible.
We're looking forward to seeing it.
So you haven't seen the footage yet?
No. Hope I don't make a fool of myself.
Well, you finished runner-up. I mean, you couldn't have made that much of a fool of yourself.
Yeah, I mean, I don't think I backstabbed too many people, but that's kind of...
I've never watched an episode, I'll freely admit, but
Okay.
The sense I get from hearing people talk about it is that's kind of part of the bit.
A little bit. It's about carrying favor, and and kind of trying to control the game, but not be too kind of out there as you don't want to appear as the leader in this, because the leaders always have a target on their back.
Right.
So it's kind of you want to try and control the game from kind of behind some people who protect you.
All right.
It's
Well,
just fun.
that's awesome. And we don't want to, I'm not going to ask you too much because I don't want to spoil too much, because hopefully the videos come out and we will share
All right.
those when they do.
I shouldn't have said how I finished.
Well, I mean, that's sort of well known, but we'll I think knowing who won and knowing how it came about are two different things.
Yeah. No, it's a first time that they've done this, and just a fun little kind of lighthearted thing. So I don't think anyone, it's within our friend group, so I don't think anyone is, I'd say a couple people are still probably, there's some bitterness with a couple people, but for the most part, it's just lighthearted.
I would hope so. I mean,
it's like a $100 reward at the end, so it's not the $1 million.
It's not even paying you for your time, but it's for fun. Like, it's totally worth it.
Yeah,
something
and some of our friends gambled on us to see who would win, and those people made more money than the actual winner of the Survivor.
Did any friends bet on you?
A few, because I'm new to the area. I don't think people knew me, so I was kind of like right in the middle of
the dark horse.
Yeah, a little bit. The person who won and I were basically right in the middle of how many people were betting on us.
That's awesome. Well, very cool. Well, we can't wait to see the footage. Hopefully it gets put out soon enough, but it's very exciting, and hopefully you'll do it again.
If they invite me back, if I haven't burned too many bridges.
Well, Dan, thank you so much for talking to us today about both about the serious and the irreverent, if you will. But last couple of questions. First of all, what is your favorite Jewish holiday?
Ooh, it's a good question. I'm really looking forward to Rosh Hashanah. It's a great time that we have. Obviously, any Jewish holiday that involves my family cooking is always a great event. We have made it more of a potluck now that everyone brings some tasty food. But it's also nice to kind of think of it as a new start and a positive slant of optimism looking at the new year. So I think that Rosh Hashanah is probably one of my favorites.
Excellent. And what is your favorite Jewish food? Speaking of food that you might bring to your Rosh Hashanah.
Ooh. Let's see. I got to think about that one. Oh, well, I would say that involved with Rosh Hashanah, one of our traditions would be my family's knishes, which were originally my grandmother's, and the tradition has continued after she passed away. And they're just, incredibly tasty. Nothing healthy about them, but they're wonderful.
No, there never is, but they're so good.
Yeah.
Well, excellent. Well, Dan, thank you so much for joining me. I appreciate getting to talk to you, and hope you and your family have a great New Year.
Well, thank you so much for talking to me, and I appreciate this opportunity to give some good information to your audience.
The Who the Folk podcast is part of the Jew Folk Podcast Network, a product of Jew Folk Inc. Please subscribe, rate, and review the show wherever you get your podcasts. If you have suggestions for other podcast guests, please email them to me at editor@tcjewfolk.com. For our other shows, check out tcjewfolk.com/podcast.